This is a comment reply to Deli Tane's comment. So let's talk about the good, and there are a lot of goods, the bad, and sometimes the ugly of immediate dentures. When I have a patient come in to consult for immediate dentures, I really like to tell them all of those things, the good, the bad, the ugly, because I want them to be informed and I want them to have realistic expectations. Let's talk about the good, okay? Immediate dentures give the patient immediate teeth, an immediate smile. That is very important for self-confidence. There are a lot of patients who heal up before getting their dentures, and I've seen that work out. It's just not the way that I prefer to do things because of the other good, which is the immediate denture acts as a bandage over those extraction sites. Not only that, but it also helps to form the ridges. So when you are not wearing any dentures after you get your teeth pulled, those tissues and that bone can, start off nice and supple, but because you're chewing against your gums, it can flatten out and widen out and it not be a favorable shape to wear dentures in the future. And even if you're not chewing hard against that, there's nothing to really form that ridge because there's nothing holding it together. There's no parameters for that ridge to heal within. So those are the good parts of immediate dentures. Automatic smile, forming the ridge, acting as a bandage, and you're learning. You're learning how to use a prosthetic device in your mouth. So you're learning how to maneuver that to eat and to chew, to talk. So that's wonderful that you're learning to do that right out of the gate, because if you go without dentures for a prolonged period of time, you're not learning. And then when you do get dentures, now it's going to be a shock to your system. So it's kind of like, you get your teeth pulled, then you have no teeth, and you get by with that, and then you get a prosthetic. So you're learning two different processes to get by instead of that one if you get that immediate denture. So those are the goods, okay? Here's the bad. And I really am very forthright to my patients before they go through this process that there is always the chance that the immediate dentures are not going to look perfect. When you get replacement dentures or permanent dentures, your teeth are gone. So we can set all the teeth in wax and try them in and verify that that bite is perfect. Verify that that midline is perfect. Verify that your teeth are, looking straight and not cockeyed in your mouth. But when you get immediate dentures, we cannot try them in. We are using an educated guess, which mine is very experienced and very educated, and most of the time I get it perfect. But sometimes patients have such terrible natural teeth. Some might have come out of the gums way too far. Sometimes their jaw is really messed up because their teeth are just so bad. Sometimes it just doesn't work out for those dentures to look perfect. And sometimes that bite can be off. The only thing that I cannot control in the whole process of making dentures is the way the patient puts their jaw together. I mean, I eyeball it and I look at it and I try to make sure, but I'm not controlling the patient's musculature. So if we're, taking impressions and doing, capturing that bite for an immediate denture, and the patient cocks their jaw, pushes their jaw out, pulls their jaw back, any little thing that I can't catch, because it's hard, then the bite's going to be off when I make the dentures, because when I'm capturing however they're putting their jaw together when they're doing their bite, and then I make that immediate denture, I can't verify the bite, can't try it in. So however they bit, that's where I'm setting that bite, that's where I'm setting those teeth. So that's the bad. It's not always perfect with immediate dentures, and that's why I give that disclosure to my patients. This is the process of immediate dentures. There is always a chance that the bite can be off a little bit. There's always the chance the midline can be off a little bit. There's always the chance that you're not going to like how they look. The other challenge that we have when we're making immediate dentures is the patient's gums are still very big because the teeth used to be there. And when we're setting teeth, you know, we only have so much space between the upper gums and the lower gums, and they're really, really big still, to place teeth. Okay, so a lot of times when we're making immediate dentures, I have to grind and grind and grind those teeth short enough to fit them in when the gums are still in my way. So oftentimes when patients get immediate dentures, they're like, why are my teeth so short and I'm so gummy? Well, because your gums are still very large. So I disclose this to the patient. This sometimes is the result. So that's something you have to make the decision to do. If you want to go without teeth and wait till you're healed, there are, you know, risks with that. But if you get an immediate denture, you may not love the way that it looks. You may want a new permanent denture later on. And a lot of providers just straight up will not even entertain relining that immediate denture. They'll just say, you're going to get a denture now, and that's your healing denture. Later on, you're going to get a new denture. Period. End of story. I really try to make that immediate denture as perfect as possible because it's savings for the patient to be able to have that immediate denture, wear that, and then 6 months down the road, we put a permanent reline in that, and then it becomes their permanent denture and they can wear it for years. You need to really understand, and I think providers need to be much more open about that immediate dentures can sometimes not be perfect. Your tissues are changing so much during the process. Your bone is receding, that denture is going to be super loose right out of the gate. As soon as that swelling starts going down after 72 hours, that denture is going to get loose. And in your comment up here, you had mentioned that there's a space between the top of the denture and your gums. That is part of the process. Your tissues are shrinking and you're developing that gap between the denture and your gums, and that's just natural. That's part of the process. So what you need is, you know, a temporary reline so that it can tighten that denture back up and restabilize it. But unfortunately, if that midline is off, if the teeth don't look great, then you're gonna have to get by until you get to your healing and stabilization point to get a new denture. So I just wish that providers would be more upfront to disclose this to patients, because this is something I see on this platform a lot, is patients being really frustrated because they don't understand why that's happening. But it's a predictable possible outcome. I hope this helps you guys, and sorry that there are good, bad, and ugly parts of this process. Have a great day. Bye-bye.